Bobby, very good evening to you. Thanks for your time. So what does the latest research say about continuing with antidepressants during pregnancy?
First of all, thanks very much for having me. What the latest research says that if you stop your antidepressant during pregnancy, you have a 65 to 80% chance of actually relapsing. So it's very important that you actually continue your medication in order to remain well.
So let's just talk about depression itself during pregnancy now. Is this something that can set in or be caused by pregnancy? Do you have to be predisposed and having suffered with depression before falling pregnant? What are the different scenarios where this medication might apply or be prescribed?
Well, women who have had a previous history of mental illness are in fact predisposed to mental illness during pregnancy. But the hormonal changes that happen during pregnancy may also predispose vulnerable women to developing mental illness.
So is it always the case that antidepressants would be prescribed during pregnancy? Are there other methods? And are antidepressants, are pills just the last resort, or they should be the last resort?
Well, we actually use psychotherapy as our first-line therapy because, psychotherapy is really effective and it's really safe to use during pregnancy. I wouldn't go as far as saying that antidepressants are the last line of resort. We would definitely use them, though, as more of a second line than just go ahead with an antidepressant in somebody who is pregnant and breastfeeding.
So explain to us then, Bobby, what might happen if one were to sort of maybe, just be scared or decide that they didn't want to carry on with antidepressants during pregnancy. What would be the harm to both baby and mum?
Well, for mum, the big risk would be that you would become depressed or anxious again. And for baby, there's a risk that if you're pregnant, you might go into preterm labor, that your baby might be born small for its age, or that later on the baby might have developmental problems. But really, if we treat depression, we see that these things don't happen. So that's why we really want to emphasize to women, don't just stop your medication. Stay on the medication. And if you do fall pregnant, go and see your doctor and have a conversation with them.
So are there absolutely no side effects to worry about then if one stays? Or is the jury still out on that bit?
No, look, with any medication, there is a risk of side effects, and the biggest concern we have is birth defects. But with the most commonly used antidepressants, we know that the risk of birth defects is very, very small, in the region of less than 3 to 5%. So you compare the risk of less than 3 to 5% to a risk of more than 60% of becoming depressed again. In women who have depression, we would make carefully considered decisions in most cases to ask them to stay on their medication during pregnancy.
So I'm assuming, Bobby, that there are certain types of antidepressants that can only be taken during pregnancy.
Yes, we have various different classes of antidepressants. The most common of them would be the SSRIs, which would be drugs like, say, Muzak or Lexamol. And these drugs are actually extremely safe to use both during pregnancy and breastfeeding.
I mean, anyone who's a mum might, understand or say, look, pregnancy can be very difficult. It's not always, flowers and butterflies and loving feelings all the time. It can be a difficult time for some people. So how then do we differentiate between depression setting in during pregnancy or catching up with you again during pregnancy and just, normal pregnancy tiredness, fatigue, just feeling down and low on energy?
It can be quite difficult because, like you said, there's normal pregnancy, fatigue, feeling low. But the two things that we really look for are depressed mood, and depressed mood that lasts most of the day, nearly every day for at least 2 weeks, and then loss of drive, loss of pleasure. We also look at things like irritability. We see how is the mother's functioning or the pregnant woman's functioning impacted. And then last but certainly not least, if somebody's having any thoughts of harm towards either herself or her baby, we would take that very seriously.
Thanks very much for that. That's Bobby Vaithalingam, Dr. Bobby Vaithalingam, just giving us the latest research there, what it says about antidepressants, some of them being safe during pregnancy.